The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
A wound care center affects patients by giving advanced therapy to wounds that are very difficult to heal. Patients who have had diabetic foot ulcers and venous ulcers that have had therapy in other places often come to us because they've taken months and made no progress, and we have advanced therapies that enable us to help them heal faster. The types of wounds that are treated fall into basically two categories. The more common ones, diabetic foot ulcers, venous disease, vasculitis, osteoradionecrosis, surgical wounds, and traumatic wounds are reasonably easy in our hands to heal, and we have over 95–98% success rate, close to 100% in most of the common wounds. The other group are wounds that have had therapy elsewhere and have not healed and have strange reasons for their lack of healing. That's obviously for us a little more challenging, but that's where we pride ourselves in being able to come up with good solutions. HBO therapy, or hyperbaric oxygen therapy, is used with wounds that are difficult to heal in specific indications. The most common indication is diabetic foot ulcer or osteoradionecrosis of the jaw or facial bones. HBO therapy requires the patient to be in a diving chamber, essentially. We use a single-chambered HBO as opposed to multi-chambered HBO, and it's basically used to add oxygen to the tissue serum and plasma in the tissue in order to enhance the oxygenation of the area around the wound and provide oxygen for the healing cells that are going to migrate into the wound. Well, first, wound care doctors come from many different specialties. At our center, for instance, we have a physiatrist, we have primary care physicians, we have a podiatrist, and surgeons. The key thing is that they undergo special training in the care of, in the advanced care of wounds, so that they bring that expertise in addition to their own clinical expertise into the care of the wound. What makes them special is that we pay attention to the wound and all the factors that might impact upon its healing, including nutrition and other systemic problems that the patient may have. So that you get a comprehensive evaluation, and we look to some of the all the factors that may impact upon the healing of the wound. The other thing which people don't really find out until they actually arrive at the wound center is we have a little more time to direct solely to the healing of the wound. In other words, you're not coming into us to treat multiple problems, you're coming in for a single problem, and therefore we can sit down and spend a lot more time with the patient to debride the wound and to help it to heal, and also to get into the underlying factors.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.